In 2026, the people doing some of the most vital work in our society are collapsing under the weight of it. Frontline social workers managing life-saving youth interventions spend an enormous portion of their week simply trying to organize paperwork. For years, youth nonprofits have operated in a state of constant triage. To get through the day, they adopt an architecture of survival. They rely on scattered, overlapping tools, isolated text message chains, messy shared spreadsheets, and manual paper sign-in sheets. None of these systems talk to each other. When program data, emergency contacts, and attendance logs are scattered across different platforms, staff are forced to act as human data bridges. They spend hours manually cross-referencing files and fixing errors instead of mentoring youth. Even the most empathetic teams hit a hard ceiling when their hours are consumed by the mechanical friction of their data systems. Their capacity to help is restricted by the sheer volume of the administrative backlog. At the same time, the rules for securing the funding that keeps these organizations alive have changed. Institutional grantors and private philanthropists now strictly require empirical, data-backed proof of a program's impact. Donors have moved past simple outputs, like counting how many meals were served or how many kids showed up on a Tuesday. They demand outcomes, precise metrics proving a lasting, structural improvement in a young person's life trajectory. It is impossible to prove to a major donor that a mentorship program reduced truancy if the only evidence is a smudged handwritten attendance log. Modernizing this digital architecture has become an existential requirement. Without it, organizations find themselves excluded from the major funding cycles they need to survive. To prove those long-term outcomes, successful nonprofits are focusing on a specific analytical variable, program dosage. This is the exact measurement of time a youth spends actively engaged in a specific intervention. Capturing that metric is difficult outside a traditional classroom. Girls Inc. of Pinellas, for example, operates highly effective STEM programs and events off-site, where standard computer logins aren't an option. They solved this by implementing mobile attendance tracking. By capturing data directly in the field, they measure the true hours served, removing the need to estimate participation after the fact. Knowing exactly how many minutes a student spent building a robotics project transforms anecdotal success into hard, quantifiable data. The logistics become even more complex when organizations mix their delivery methods. The Brzee Foundation faced the challenge of measuring dosage across a blurred environment of both virtual counseling and in-person programming. We stripped away their paper systems and deployed ID card scanning software. This maps a participant's exact path, showing the interconnectedness between the virtual services they log into and the physical spaces they visit. Now push that complexity to the absolute limit. The Police Athletic League of New York City serves 35,000 children every year. Operating across more than 20 sites in volatile urban neighborhoods, attempting to manually track program dosage at this scale is physically impossible. They rely on a specialized database architecture that acts as a singular, unified hub, absorbing data from every location in real time. As an organization grows, this centralized architecture is the only operational framework capable of managing the variable of dosage at an institutional scale. When you capture dosage data across a participant's entire life cycle within an organization, you gain the ability to prove how a specific intervention altered their future. Because the Police Athletic League meticulously tracked program dosage over the years, they reported a definitive outcome for their senior cohort, a 100% on-time high school graduation rate. They also correlated that exact same dosage of youth programming to a 90% college enrollment rate. Presenting this verifiable evidence of life transformation is the primary mechanism for securing funding in a sector that has moved entirely toward outcome-based philanthropy. The dividing line between nonprofits that thrive and those that struggle is clear. Today, an organization's software strategy is indistinguishable from its mission strategy. These systems are designed to absorb the crushing burden of compliance and paperwork. They handle the repetitive tasks that typically lead to staff burnout. By engineering digital scale, these organizations free up their human capital. This allows youth workers to step away from the spreadsheets and focus entirely on building the deep, empathetic relationships that actually save lives. Stop letting fragmented tools limit your impact. Visit highbox.co to schedule a demo and unify your organization today.